So welcome to our webinar entitled Community Engagement in Humanitarian Action. What does nothing about us without us mean? This is hosted by the Humanitarian Governance Project here at the International Institute of Social Studies, Erasmus University, Rotterdam. So as we will be discussing to you in a bit, this is a special episode of the HumGov webinar series because this is done in collaboration with UNICEF. And of course, I would also like to acknowledge Fiocruz and Makerere University, who have been our partners in making this event possible. My name is Kyra Zoe Cañete of the HumGov project, and I will be moderating our webinar today. I'd also like to acknowledge my teammates, Hyunggun and Gabriela, who have also joined us here today. So before we provide the rationale for today's event, I would like to go over some housekeeping so that we can ensure a smooth flow to our very interesting discussion today. So today's webinar is scheduled to last 1.5 hours, including a Q&A. I would like to request all attendees to mute their mics so that we can enable a panel discussion without much interruption. You can also use the chat feature to communicate to the moderator, me, or each other during the discussion. You may also use reaction features to express your feedback to the speakers. And during our Q&A, please use the raise hand function to be acknowledged. And alternatively, you may also use the chat for questions. And again, I'd like to reiterate that this webinar is being recorded, and it is also simultaneously being live streamed at the Fiocruz YouTube channel. Okay, so why are we holding this webinar? So community engagement is really one of the central concepts in humanitarian action in recent years. So there has been much concern about the need for quality and accountability and placing affected people at the center of humanitarian action. However, different contexts and relational dynamics between various actors and affected communities have produced different practices as well as challenges in engaging with communities. So the HumGov project, which is financed by a European Research Council advanced grant, has a special focus on civil society actors and crisis-affected people and how they shape humanitarian governance by using accountability and advocacy. And these issues have been a subject of our past webinars as well. So for this reason, we were very excited to partner with UNICEF, particularly with their Social Sciences for Community Engagement in Humanitarian Action project on a webinar series that highlights the tensions as well as lessons surrounding the project and practice and ethics of community engagement. So this is actually just the first of a series of webinars, and so we're very happy to have you all here with us today. So in this regard, I would like to hand the floor to Fernanda to give us from UNICEF to give us a brief description about their initiative as well.
Thanks very much, Kaida. Thank you so much, and thanks everybody. Can you hear me well? It's okay. Yeah, sorry. Just wanted to give a brief introduction, explanation about the Social Sciences for Community Engagement in Humanitarian Action project. This is a project that was convened by UNICEF, but we are working currently with more than 70 partners that include humanitarian practitioners, civil society organizations, and researchers from academic institutions. The idea of this project, the goal is to work on a collaborative way to strengthen global and regional demand and capacity for social science integration into humanitarian programming to ensure engagement of affected and at-risk communities throughout the humanitarian program cycle. And this is very important. We work really close and in connection with the humanitarian program cycle, understanding response, preparedness, and recovery phases, and how social sciences can fit into each one of these different stages. Of course, the focus is to support, responses, of course, as well, humanitarian responses, in a very adapted, rapid, and increase the effectiveness and efficiency of humanitarian emergencies. For this, the project focuses specifically on the development of global goods in this collaborative manner. This is very important. This is not a one-sided UNICEF project. It's a collaborative effort with voices from, as I explained, different sides, the North and the South included. So we work on and reflecting, the process is very interesting process, on the reflection on the ethics and data sharing guidelines and code of conduct for the application of social sciences for community engagement and humanitarian action at the different stages, as I explained before, in linkage with the humanitarian program cycle. We also work on capacity development, understanding what exists in terms of trainings and capacity development specifically for the application of social sciences. And also we're looking at data systems, community engagement data systems, tools, and guides. First, in all these three elements, we are looking at what already exists. We look at processes that are ongoing. We look at structures that existing today, and we try to be embedded in those either processes or structures. We do not want to create a parallel system or work on isolation, on what we call a navel-gazing exercise on social sciences, looking at that only. But we want to be merged. We want to be embedded in the humanitarian system and the structure as it functions today. Of course, this means understanding all the challenges and criticisms that are currently ongoing with, for instance, the decolonization agenda and all the criticism that brings. So we are bringing that agenda as well in the elements that we're working on. We want to look at those aspects of the global North and global South relations and decolonization of research, decolonization of humanitarian aid, the understanding of all the processes that are behind and how this project can contribute, to this. But again, as I said, systems approach, understanding the humanitarian system, being embedded and looking at how we fit into those processes, but always with a critical look and looking at how to, let's say, I don't like to use the word empower, but how communities can play the role that they should be playing and get to this even ownership of humanitarian responses in all the project cycle, of course, and the program cycle for humanitarian aid. So thanks very much, Kaida. Please go ahead.
Thank you so much, Fernanda. So just as a note that this is still the first of our series of webinars, and I hope that everyone will stay tuned to the other succeeding episodes that we will also have. So now the main part of our webinar, it's my pleasure to introduce to you our panel of speakers for today. And we're really thankful to them so that they can, they give us their time to share with us their insights and experiences drawn from their work in different humanitarian contexts, from HIV/AIDS struggle in Brazil to community engagement in humanitarian responses in Latin America and Uganda. So our first speaker is Professor Richard Parker, who is Professor Emeritus of Sociomedical Sciences and Anthropology and a member of the Committee on Global Thought at Columbia University in New York City. He is also the Director and President of the Brazilian Interdisciplinary AIDS Association, a leading non-governmental AIDS organization in Brazil. He's also a founder and co-chair of Sexuality Policy Watch, a global coalition of researchers, policymakers, and activists from a wide range of countries and regions, with secretariat offices in Rio de Janeiro and New York City. So he's also founder and chair of Global AIDS Policy Watch, a knowledge network and policy watchdog initiative on the global HIV pandemic. Our second speaker is Deepa Victor. Deepa has expertise in developing community engagement strategy through participatory processes in the humanitarian context. She has worked in community-based projects in India for over 20 years before moving to international projects. Deepa's last assignment with Médecins Sans Frontières was in Latin America, supporting projects in migration route from Panama to the US-Mexico border. And last but definitely not the least, our third speaker is Associate Professor Paul Bukuluki of the Department of Social Work and Social Administration, School of Social Sciences, Makerere University. He is a social worker and medical anthropologist with more than 15 years of experience in implementation research in the fields of gender norms, social norms, sexual reproductive health and rights, and violence against women and girls in development and humanitarian settings, particularly in Africa. He's a member of the Global Learning Collaborative on Social Norms and the East Africa Learning Collaborative on Social Norms. Again, we welcome our three speakers, and without further ado, let me call on Professor Richard Parker to discuss to us his work with the Brazilian Interdisciplinary AIDS Association.